Labor says there's a crisis. The government says don't talk down the sector. But there's no doubt, because both the industry, the sector providers and the unions, workers, are saying there is a crisis, in particular about staffing. Excuse me. So what they're saying is, there's obviously been a huge issue in terms of COVID. There's been lockdowns. There's been a record more than 1,200 people have died from it.
Yeah.
That's just this year. That's more than any other year. There's been, because of that, staff shortages, families have been locked out. So there's been a lot of reform and a lot of money put towards it. But what the workers and the providers are saying is, if you don't have the staff, then the conditions just don't improve.
Yeah, despite the Royal Commission, there are still some horror stories coming out of aged care. Okay, so let's take a good look now at what the major parties are offering in this area to try to overcome the challenges that they've been.
So in the first instance, one of the major platforms from the ALP is saying that there'll be a registered nurse on duty 24/7, and that was something that the Royal Commission recommended. They did have a timeline for it. Now, the Coalition has said that a registered nurse will make other providers and homes go under, especially in regional areas. It's not feasible. They're promising a registered nurse on duty 16 hours per day from October next year.
And so what do you make of the relevant arguments on that issue?
Well, I mean, there used to be a registered nurse on duty 24/7 before 1997, which is when the John Howard changed the Aged Care Act. So this isn't something new. However, there is a problem with supply. COVID means that we don't have the staff coming in from overseas, which the industry relies on. So the ALP is saying that they will import workers until they can train everybody up. The Coalition is saying that's just going to cost too much money and will send homes broke.
Okay, so let's now move on to some other areas.
Sure. So the other issue is just a wage increase for personal care workers, who make up 70% of employees. The Fair Work Commission is going to be looking at a wage rise for them. They've basically said that they'll honour that. The government says that they can't afford to do that they won't fund it directly, but there'll be an independent tribunal that will decide on total funding overall. And the other issues, the ALP is promising penalties for...
Yeah, well, just before you move on, and so what's the ability, because Labor said it will fund that increase in wages, or how does, is it apparent that Labor, that the government will actually be funding that even in private aged care facilities, or how would it work?
So, Labor is saying if they win government that they will essentially fund it, and they're saying it'll cost about, I think it's $2.5 billion over 4 years, on top of the 16 hours per day that the government's already going to fund. The government says, first of all, that they won't do that directly. The Royal Commission recommended an independent pricing tribunal that will look at all the factors involved, and they'll set the annual funding for aged care for that year, and they're saying that that will be part of that. So it won't be in their hands, whereas Labor says it's so urgent, we're going to fund it directly.
Right, and so there are clear differences there between the major parties on how they approach that?
Well, there is, because the independent tribunal is not set up as yet, so there's no way that they're going to be able to set that. Providers are already saying that they are already losing money. 60% are losing money every day. There's been a lot of aged care homes closed since the Royal Commission because of COVID, extra costs, can't get staff, etc. So there's been a real issue just in that, and because of the poor wages, staff are just leaving the sector, especially because they've been through COVID. It's been emotional, draining, they've worked really long hours. They only get maybe $23 an hour, so it could be a huge increase of 25% for them if it goes ahead.
Yep. Okay, now moving on to some of the other issues and back to the graphic, just on the Coalition side, this extra $10 per resident per day. Take us through that.
Yes, so there's, after the Royal Commission recommended that the food should increase, the quality of food should increase, they said that the government committed to an extra $10 per resident per day. Homes have to show how they're spending on food. However, that is just self-reported. I've looked, so there's been mixed reports from families and staff about whether it has improved. They're saying that some places have put it towards that, but there's no requirement. So one of the things that the Royal Commission wanted was more transparency. This just goes to show that they don't actually have to show how much they've actually spent. There doesn't have to be any receipts or any actual shoring up of what they've spent. ALP says they're also going to improve food, but one of the things that they said they're also going to do is they're going to increase penalties or have penalties for nursing homes which are consistently found to be guilty of neglecting or abuse or serious incidents. At the moment, there's no penalty. What happens is if a home is found to consistently be in breach of the standards, they just are asked to correct them. They have to employ a nursing consultant to do that. So a lot of the Royal Commission also wanted something much tougher to make sure providers do make those improvements.
Yeah, and so for families in aged care who you've been in touch with over the years who've dealt through the trauma of everything that's happened there, what are some of the key things that they'd like to see, and how do the major parties, do you think, stack up on these?
Well, I think so many families are traumatised by COVID, either deaths or their family members being locked away from them for months at a time, and especially over Christmas, New Year. They've deteriorated because they don't have the staff to potentially feed them, for example. A lot of people need feeding. A lot of people have dementia. So they've seen malnutrition and dehydration problems increase. There's talking also, we also know that antipsychotics use is still very high. So chemical restraint is still happening. 1 in 5 are on an antipsychotic in aged care, which is pretty astounding considering new regulations came in to try and stop that. So they've got lots of concerns like that. The food, they say, in some places has improved, in other places it has not at all. So they don't see where that money is actually going. And in general, it's about not having a registered nurse and not having properly trained staff. The Royal Commission also wanted a minimum training standard for aged care staff, and the government rejected that. So there's a lot of issues that remain exactly the same as before the Royal Commission that haven't changed. And I do think there have been some improvements, I must say, just from speaking to people. I don't get as many emails and letters and complaints from people, and I do know that in some places things have really improved, but I do know providers are struggling as well because the Royal Commission wanted a levy. They actually wanted a tax, which meant that everything would be funded. There wouldn't be restrictions on funding. But what has happened is the government has put $18.8 billion in over the next 4 years, and they're saying, well, that's fine. The providers are saying that's fine, but that's a finite amount, and it's not going to help when we've got this increased staffing, increased registered nurses, and so forth. And
do you know what Labor has said on that levy proposal?
They've rejected it as well.
Right.
Both parties rejected it because it's seen as a tax, and neither side of Parliament wants to introduce a new tax and be attacked for it.
And after all the work you've done in this field, do you look forward with hope to what's happening in the sector, or there's still so many issues that it's kind of hard to look at things optimistically?
I do think that there's a lot that was in the Royal Commission recommendations that just haven't happened and they have not gone ahead, and I think that's a really big problem. The very fact that antipsychotics can still... the Royal Commission wanted antipsychotics to be prescribed only by a gerontologist or a dementia specialist. Now, that hasn't changed. GPs can do that. There's no minimum training for staff, which seems incredible because these are things that... the Royal Commission wanted. And the other thing that previously happened is that there was greater an incentive or requirement for providers to actually spend most of their funding, 70% of it, on the wages, so you knew that you had the staff. Now that's just disappeared. So there's nothing there's nothing requiring providers to spend all of their funding on staff, which has got to be the most crucial aspect in aged care. So there's the transparency issues, the justification for how funding is used, and also just the the problem with the numbers of staff and the lack of staff mean there's a long way to go. It's not a short-term issue. They really are going to have to work hard.
And you'd like to see some more announcements on this in the election campaign. Have you seen that much in terms of like specifics?
Well, there does just seem to be very much a focus on the registered nurses, the aged care workers' wage increase, and a little bit about food. But what hasn't been talked about is that the regulator, for example, got a lot more money, but we are still hearing terrible stories. The lockdowns that are still affecting families. Staff are still telling us that there's just not enough of them, that there's just 5 minutes to attend to each resident. So there's so many issues, and I don't think that either party is going to get into them because they tend to be too complex. They tend to be repeating pretty much the same things. But I do think the Fair Work Commission ruling, which will probably happen at the end of this year or early next, will be really interesting, and I think a lot of aged care workers and providers will be happy about that if it's funded.